All right, great. So, hey, I am so excited here. I've got the co-founder and CEO of Renew Light Systems, and as a lot of you know, we are just so excited to bring this new technology within our office, and to have the CEO and co-founder of the actual company. Awesome. This is Dr. Neil, and as you guys know, 30 years in practice. We have tried to go into another involvement within the holistic healthcare just genre. And Dr. Neil's going to come on, and he's going to kind of, I think, do a better job than I can of explaining a little bit about the science and the behind the scenes that I think a lot of you might be interested in now that we're offering a service to Jacksonville. So, hey, Dr. Neil, appreciate you coming on.
Hey, Dr. David, thank you for having me on. I'm really excited about this opportunity to share this technology and what it means for your community. I know what it's meant for mine and my practice. And so to give everyone out there a little idea, I've been practicing since 2000 and got into what's called photobiomodulation, which is using photons. I know it sounds like something from Star Trek, but that's really wavelengths of light to produce energy within the cells of the body. So to enhance the abilities of the body. So started doing that in about 2012. The technology was there, but it wasn't quite there. A few years ago, the technology really started changing. What this is Renew Pod. So it's a whole body system, and it bathes the body in light wavelengths. So we use 4 biologically optimized wavelengths to stimulate cell energy. And I'll get more into that a little later. Everyone's heard of the Krebs cycle. So I'm a big, Krebs cycle nerd. I was a biochemist in my last life for a pharmaceutical company. And so I love the Krebs cycle, but that's where in the cell, there are these powerhouses or engines called mitochondria. And so there's a thing called mitochondrial dysfunction, and that's really what's harming us in general and harming our health in the long term. So what this does is it's a cellular regenerative treatment. So we're going to stimulate those engines to produce more energy. And these energy packets are called ATP. And this is what helps tissue repair in the body, healing, recovery, stimulates metabolism, fat melting, for lack of a better word, helps the body detox, and just there's so much research out there on this. In my office, I felt guilty if I did not put a patient on this therapy, because I realized whatever else we were doing to help the patient, this was going to boost the outcome. So it was going to give the body a better outcome, a better chance to take whatever we were doing with it and heal itself. So it resonated with me and I loved it. So we were doing many different things in the office. We were doing, we're helping disc patients, back pain. We were helping even weight loss and body contouring. We were helping neuropathy patients. We were doing regenerative medicine in the office. We're using stem cells, putting those patients on this treatment because I knew that this was going to help the body take what we were doing with it and improve it. So it's really exciting.
Yeah, I mean, I see myself as, if I'm a patient, I'm going to try to ask some questions that I would want asked, right?
Sure.
And so I do kind of remember the Krebs cycle for sure from school. It's been a while. I've been seeing, and obviously we've all been seeing this technology in the news. I think it's almost becoming a bit mainstream. It's getting close.
Mm-hmm.
I know one question, and if I was a patient, and I personally have used red light in my own past, just at home and that, and I know the question is going to come out there. Well, I got my own pad. I went on Amazon, I paid a few $100 or maybe a few $1,000s for a pad. How is this technology different? Is it better? Is it more powerful?
Yeah. That
How can maybe,
I love that you just asked that question. It's a very common question with our providers across the country and their patients. So red light is coming back around. The technology is there now. Here's the biggest difference. So this is a medical grade unit. Okay, it's a medical grade system that we use. What's given to the consumer or sold to the consumer is something called consumer grade. So not as powerful. They can't offer the higher wavelengths that we offer, the infrared wavelengths, because a lot of these companies, would be, you can hurt yourself if you get a medical grade piece of equipment, use it at home uh, without supervision. And that's what this is. So we have clinical protocols. We get some patients going to their doctor going, hey, I read that 25 minutes a day, every day is what I need. And that's not the case. So what this does is it has a certain amount of power with the wavelengths. It generates something called joules or energy,
okay,
and it's called a therapeutic dose, right? So it's like taking vitamin D. You're vitamin D deficient, go to your doctor and he prescribes 50,000 IU of vitamin D supplement. They take that, they go back 3 months later, get blood work, and they're back to normal, right? You don't keep taking that therapeutic dose. You have to cut down to maintain it. And that's what light therapy or photobiomodulation is. So there's going to be a therapeutic window, say 2 or 3 months. Then there's going to be maintenance after that to keep the energy in your tissues and keep the cells energized to continue working properly. So I like to call us solar powered. So we 90% of Americans, it's the data's out there. They're light deficient. They're not getting enough sunlight, and so that Krebs cycle and that mitochondria dysfunction is there. But I'm digressing. Let me just short answer to your question. So there's a consumer grade and a medical grade. Mm-hmm. So you can't, it's like taking a supplement from over the counter. So at your Walmart or your GNC, right, versus taking a pharmaceutical medical grade supplement. You're going to absorb more. It's going to be more efficient, and you're going to not need as much of it. Does that make sense?
Yeah, and I think it's important. You can do too much of it, for sure. And so it needs to be, I think, guided by a professional, because you certainly, and you tell me, I feel like the biggest benefit that I read is the effect on inflammation within the body. And I've done some functional medicine, and we're always talking about gut and gut health. And I'm always trying to help my people to help them with their inflammatory process, especially with visceral fat. And I mean, this thing, when you read the research on it, is amazing, it seems, for that, which can have just amazing effects on the body, whole body. But you can do too much, right?
So that's where all this kind of came about, is that I was looking for some way for my own patients to help them reduce the inflammation inside their bodies. And so we also developed a 60-day, I call it a functional medicine kit in a box, as a matter of fact, but a program that, with the photobiomodulation, which with the Renu pod and the wavelengths, 10x is the results, and gets rid of the most of the California, I call it California brush fire, going on in our bodies. So, things like sugar and toxins and free radicals, what they do is it's like pouring gasoline on this brush fire. And so, that's why COVID had such a field day, is because we had these raging brush fires in our bodies, and our immune systems didn't know where to go. And, so that's what I was looking for.
I can tell you, this is unscripted. We have our front. So of course, when we got the system, we got the little functional med kit in a box. We have those to, guys, we want to try all this ourselves. So myself, Cindy, our front desk, has been on it. She's been wanting to lose weight for a long time. And, she's the type of person, she's awesome. We all love Cindy, but she's tried everything, and age and this and that and hormonal, never been able to lose weight. She is down 19 inches in just a little over a month. 19 inches and close to 20 pounds. So
That's beautiful.
give her a heads up when you see her, but she's using what we're really not talking, we're using what he's talking
This
about.
whole
It really amazing. Yeah, the drops along with the red light she's been using. We've been sneaking in there when you guys aren't there using the equipment.
And Dr. Day, I want to tell you, you just hit the nail on the head. So it's so the reason why this works so effectively is because we're treating the cause of the weight gain, not the weight itself.
Right.
So we can take GLP-1s, we can take Ozempic, Mounjaro, all those fancy injections out there, skinny shots they call them. But the reason why we gain weight is because of all the toxins in our body. I had fun in college. I don't know about you, but I'm 55. I like to give seminars, tell people I'm really 95 and the anti-aging works,
Yep.
And I'm spending these years undoing everything I did in my 20s and 30s. So, and that's where it comes from. So our bodies like to take fat cells and encase them around toxins and free radicals. And you're talking about stress, emotional, physical, chemical stress. And those are things that are all around us. So we're trying to undo those effects. And so when you use the nutritional formulas, when you use the anti-inflammatory diet, when you use the 4 optimal wavelengths on your body, so typically 15 minutes of exposure, more often than not, two to 3 times a week for about two to 3 months, and you are reset. We call it a reset program or a transformational program, and then your body is better to be able to handle those stresses again. So research is out there, moods, depression, anxiety. So these stimulate neurotransmitters in our brain, and people can't explain it. They'll do a session, they'll get out, and they'll go, you know what? I was really anxious before I came in here today. I'm glad I did this. I feel so much better today. And you will hear so many cool things just from just a handful of treatments. Right. And the data's out there. I do a medical presentation on high nitrate rich foods and using these wavelengths and the boosting effect they have. And so that's what we try to make it easy. We want to make it easy for the doctors. We want to make it easy for the patient. And we automated that kit in a box and using it. It's a very relaxing treatment and there's no side effects.
I can tell you, I usually fall asleep when I'm in there. And, and I can tell you just from a personal experience, 25 was a stressful year for a lot of reasons for me personally. And I've noticed over the last, I've been doing it like I said, I've had home and I've used various low level, I'd say very basic things. And I think, notice a bit of a difference, but nothing. The effect of my mental capacity, my sleep has really been noticeable. I can say probably not after 1 or 2, but after now a few weeks, it's like I've all shifted, and that reset you talk about, I feel like is starting to take effect.
Yeah, it's pretty incredible. It's a very, like, I call it just a full, well-rounded anti-inflammatory program, and that it's easier to tell you what it doesn't do than what it helps. It's a whole body treatment and it's cellular, so 99% of people can benefit from this. Now, I was telling you about medical grade, you can overuse it. So there are clinical protocols to use for this. You don't want to overuse it because you can have the opposite effect. If you overuse, you'll create inflammation. And that's the problem with, home therapy is fine. They're not powerful enough really to overuse, but these units are, and that's why they're given to providers so that they can clinically make sure that the patient's getting what they need. So.
And that's so what we've done, and you may or may not notice, but what we're trying to, because you're right, I have a lot of people say, well, I've been doing this every day. I'll just come in every day. Well, time out. And so we're offering all our current practice members a mapping, what's called a mapping session to help, hey, what's going on? I have a few patients I know that have some autoimmune disorders, which I'd like you to maybe address. So there's a lot of different chronic autoimmune disorders. There's really interesting cases, right? And so we're going to try to sit down with them. Some of my neuropathy patients in the past, we're going to sit down with them, see how we can map a targeted regimen for them. Because, I mean, it is therapeutic based, so it has to be therapeutically, it has to be medically guided. It's not just, it's extremely safe. I know it is
very safe,
not invasive, but to get the most for your money and actually not create inflammation, right? You have to have some guidance there.
I will tell you that it's worth doing because I get not only have I seen my own patients and the results they've gotten, but I get texts and emails and messages from providers all over the country using our equipment and staff, and they're what we had one spouse, a husband and wife doctor team in Nashville, and she had a melanoma that got excised from her dermatologist. She got into the bed, and after a few weeks, she went back for a recheck, and her doctor could not even find where the border was from removing it.
Wow.
She was in like total shock. Because this just isn't mainstream. It should be, but we know that it, mainstream just doesn't necessarily do everything that works all the time. But stuff like that, or we'll hear stuff that patients are there for one thing, let's say weight loss, pain,
right,
whatever the case is, and they'll let the staff know or the doctor know, hey, I just stopped taking my hair growth prescription because I started noticing baby hair growing again.
Wow.
And that's not what they were treated for, and that's what I love about this system. It's a whole body system. So yes, I'm here for whatever back pain, Dr. David, but what's really cool is it takes a lot of the guesswork out of it, because now we're getting their whole body to heal itself from the inside out. And isn't that what we're all about, is healing from the inside out? So
and I still do put people on great programs for the gut to decrease inflammation. It's a long haul and it's great, but man, if you can do that on top of having something this effective in this short amount of time, to be able to, from a cellular level, right?
Yeah.
Essentially detox and help with the inflammation. Then on top of that, you clean your diet and you do a therapeutic regimen to really get the inside of your system functioning better. Now you're regenerating. It's just
we have these are therapeutic. This is therapeutic dose, right? So you hit the nail on the head. It's a marathon. It's not a sprint, but this is to get you 80% of the way there. But all the physiology textbooks, they talk about the fibrosis repair. That's an 18-month process to really undo a lot of the different things, and then it's a journey, and
sure.
And then that's what this is about. But it's called biohacking. So we are biohacking to try to get a foundation going, and most people in 2 to 3 months will get to that point, and then you determine what they need from there. So,
in your experience, I'm curious if you had any experience dealing with any kind of we have the autoimmune disorders that just gone rampant in this country. Have you had any experience with a variety, like rheumatoid arthritis, inflammatory arthritis, lupus?
Yeah.
Not a treatment for, I understand, but maybe a management or helping symptoms.
Yeah.
Cirrhosis, but
no, absolutely.
eczema, things like that.
Yeah, absolutely. Now, lupus patients, 83% of them are light sensitive. So, not to say that you can't do use the light therapy, but I'd say do a trial treatment, see how they tolerate it. Most of them can tolerate it, and that's fine. Then you continue. Active cancer, I would not do this on, because we're stimulating cells. You don't want to stimulate that. If they're in remission, it's all good. Get them in that. Skin conditions, eczema, psoriasis, rheumatoid arthritis, definitely. We want to calm the immune system down, modulate it. Right, it's called photobiomodulation. So we're trying to modulate everything, and allergies. That's an hyperimmune system issue.
I hadn't thought about that, honestly.
So we want to modulate the immune system's response to pollen and dust and pet dander and all those things. So
maybe that's why my allergies. I haven't noticed anything lately. And
yeah, tis the season, Dr. David. Tis the season. All the pollen's out, and
yeah.
I'm in North Carolina, so we're getting hit really hard in Charlotte. But yeah, it's really amazing. So,
well, from our also, of course, guys, obviously lower back pain, neck pain, all these things that we treat, you all know, if you decrease inflammation, you're going to feel better. I do out there have a lot of my maybe neuropathy patients that I have actually in the past, and I still will, prescribe sometimes infrared light therapy boots. So just briefly, and I've had tremendous success with them. To be honest, there are times when, we didn't get the success that we wanted. Okay. It's like anything else. What I have read on this stuff, it being 360 degrees, you're not just getting the infrared, but you're getting the true red light and all the wavelengths. For neuropathy, this is a game changer, it seems.
Yeah. And it was for me. So I put all my neuropathy patients, I put this as part of their protocol. And like I said, with neuropathy, you can do 2 times a week for 3 months, or you can do 3 times a week for 2 months. So it's whatever you're able to do in terms of the patient being able to come in. But it's outstanding. There's a diabetes protocol we put together. So here's some pretty exciting data. They talk about the beta cells in a pancreas having mitochondrial dysfunction. Now imagine if we could start to get rid of that dysfunction in the beta cells of a pancreas. And now the beta cells are what produce the insulin. Now, what if we start stimulating the mitochondria to produce more energy? We start increasing insulin sensitivity, and we improve the pancreas activity. Just amazing. But it's a whole thing where we're talking about, okay, we need to bring their A1C down. So that's what this program does. And the same with neuropathy. Most patients with neuropathy usually is because of long-term chronic diabetes. There are other forms, right? There's mechanical forms of a nerve pinch. There's chemo, radiation treatments, things like that. But we want to stimulate nitric oxide production, which is oxygen. What's that going to help? Well, everything.
Right.
What's going to happen for more oxygen in the brain? Memory.
Right.
Moods, anxiety, depression, dopamine, serotonin, you name it. What's neuropathy is the nerves, small nerve fibers in the hands and the feet are getting starved of oxygen and low circulation. So we start losing circulation as we age and do some of these things. And of course, diabetes does that. We are now stimulating more blood cells, vessels. Right, it's called angiogenesis. That's all exciting stuff, and it's everyone gets the benefit of using this machine. They get the same benefits, whether you have diabetes or you don't have diabetes. Whether you have, we have an ED clinic practice out in California, 12 locations, and guess what? You're stimulating blood flow and oxygen.
Absolutely. Yeah.
So, but everyone's getting these benefits every session,
Right.
every time, and I love that. I love that.
Yeah, I
Sometimes-
love down here in Florida. We think we get all this light, but we get all this UV light. And look at me. I'm fair skinned. I like to go out, and I think it's healthy. I like to get some healthy doses of the natural light, of course. But there's a limit to what I can do. I had a person ask me, "Well, I don't want to. I'm pretty. I don't want to get burned." And
Right.
obviously, you can attest. No UV light, right? Completely safe. No UV light. You're not going to get burned.
Another great question. So that's the trouble, right? Sun is full spectrum, everything, even the harmful rays. And so UV light actually ages us. It will damage DNA, right? Especially if you're burning yourself. These are none of those harmful rays. We get it's called a therapeutic window from 600 nanometers, which appears red to the naked eye, to all the way to 940. You go too much above 1,000, and it's worthless because the water in your tissues reflect. So the therapeutic optical window is very narrow, and that's what we use in our system, in our equipment. No harmful rays whatsoever. So
Awesome. Well,
yeah.
I don't see there's really very limited contraindications other than being I think pregnant and maybe active cancer. Some considerations with certain things like lupus, but those are all things we figure out in a consultation, a mapping session that we're offering to all our patients at no charge, our current patients at no charge. So definitely be sure to text us, just your name, just reply on this text. Hey, I'm in. If your family and your friends, if you're interested, it's completely free, no charge, only for the month of May. And we will, to see how this technology might be able to benefit your wellness in the future. For sure.
Yep.
Got to
Yep.
put that pitch in.
I'm excited for your patients, and after your introduction to your
Yeah.
family and friends and your patient family. I'm excited to even get this out further to the community and let them know about it. So
Well, it's going to be awesome. I believe it's the only one I believe in the Jacksonville area. I think you might have, there's some in Florida.
yeah,
But
we have other.
nothing that I see. I've looked. There's nothing in the Jacksonville area that is as powerful as this machine that I can see. There's a lot of units that may look, and there's a lot of units that may look similar, but when I look into them, let's just say they're not near the strength, intensity, quality that this thing can give.
Well, I'll tell you right now, we've had doctors before we started manufacturing them have other units.
Yeah.
They get a Renu pod for their second pod because they got so busy that they're having trouble keeping their patients on the first unit.
Yeah.
Because they realize how much more powerful our unit is. And so it's great to see that. We take it as a compliment. And
To be honest with you, Doc, one of the persons you recommended used a competitor, and a red light system, wasn't getting any results. He sold it. He said, "This sucks. I don't," quite honestly. And through a friend, got hooked up with you guys, got it, and the results were just amazing. And now he has two. So that got me really interested because I was actually looking at the other system. I've been looking at this for probably 4 years. And so for me to pull the trigger on this is a big deal. And I'm excited because I know, regardless of how much, I know this is going to benefit my community. It's and more importantly, that's from just from my heart perspective. I'm looking forward to getting people to enjoy it and achieve a level of wellness that we need in this era of stress, anxiety, and medication. And we just
it's called longevity medicine, or anti-aging was the old term, but we call it life extension or longevity medicine. And I gave a seminar. I'd be like, okay, who wants to be younger and stronger for longer?
Me.
we're all gonna age, but we want a quality of life as we age. I want to stay strong. I want us to be able to still do things in my older age and in my retirement, and be healthy. You know,
Yeah.
my mom always used to raise us going, health is wealth. Don't worry about anything else.
Amen.
So
Amen for that.
I appreciate you.
I appreciate you. I appreciate you doing this for me and my small tribe and group. And hopefully maybe we can do something like this in the future. But it's
Yeah.
new to me. I hope people enjoyed it. And remember, just reply to this text, your name and your friends and family that are interested. And we will no charge, because it'll be 300 when we go public, but or 150. But at no charge, we'll do a mapping session, and you can see how this might benefit you. So, hey, thanks, Dr. Neal. I really appreciate it.
Oh, perfect. Thank you. Take care.
Awesome.